Eggs are healthy, right? Not if you're over 60 and you're doing this. In fact, one of the most healthy morning habits I see in seniors is quietly wrecking their nerves, gut, and even heart. I'm Dr. Max, urologist and men's health expert. And today, I'll show you 5 dangerous ways people over 60 are eating eggs and how to fix them. These aren't just theories from textbooks. They're real stories from real patients I've seen over the years. Men and women who thought they were doing everything right, but wound up in the ER or stuck on pills or struggling with symptoms no one could explain. These are the kinds of hard lessons you only learn from time spent in hospitals, clinics, and long, late-night calls with worried families. And if I can help you avoid even one of those mistakes, then this video is worth it. Let's start with a mistake I see all the time, especially among health-conscious seniors. You skip the yolk. You eat just the whites. And you do it on an empty stomach, first thing in the morning. Sounds smart, right? Low fat, high protein, no cholesterol. Wrong. Here's what most people don't know. Raw or lightly cooked egg whites contain a protein called avidin. Avidin binds to biotin, a critical B vitamin your body needs, and blocks it from being absorbed. Now, why does that matter? Because biotin is not optional, especially as you get older. It's essential for your nervous system, your energy levels, even your brain function. If your biotin drops too low, here's what starts happening: numbness or tingling in your hands and feet. This is called peripheral neuropathy, and it's often one of the earliest red flags of low biotin. Biotin is crucial for the health of your nerves, and when levels drop, the tiny nerve endings in your fingers and toes start misfiring. That creates the pins and needles sensation, or in worst cases, burning or stabbing pain. Muscle weakness. Biotin helps your body metabolize food into usable energy for your muscles. Without enough, your cells don't get the fuel they need, especially during physical activity. This leads to general fatigue, shaky limbs, or even difficulty standing up or walking steadily in older adults. Chronic fatigue. Low biotin affects mitochondrial function, the power plants inside your cells. When they slow down, everything slows down. Your body feels heavy, your mind foggy, and sleep doesn't seem to help. This isn't just getting old, it's a real metabolic energy drain. Memory problems. Biotin supports healthy brain function, especially in areas tied to short-term memory and focus. Low levels can contribute to brain fog, forgetfulness, or even misplacing words and names. In seniors, this can be mistaken for early cognitive decline, but sometimes it's just a vitamin fix away. Mood swings or depression. Biotin plays a role in the production of neurotransmitters like serotonin and dopamine. When you're deficient, these feel-good chemicals drop, leading to irritability, anxiety, or even depression. It's not uncommon for seniors with low biotin to feel emotionally off, but not know why. I had a patient, Jack, 74, retired truck driver, came in saying, "Doc, my feet feel like they're buzzing all the time. I'm worn out by noon. Is this just what getting old feels like?" Well, not quite. Jack had been eating just egg whites every morning, trying to keep it clean after a scare with cholesterol. No toast, no veggies, just whites. His biotin levels were in the basement. We added the yolks back, paired it with some sourdough and grains, and 3 weeks later, the buzzing? Gone. His energy? Way better. Look, I'm not saying egg whites are evil, but skipping the yolk and eating them on an empty stomach? That's a recipe for trouble. Yolks contain the biotin you need to balance out that avidin. Plus they come with lecithin, omega-3s, and lutein, all key nutrients for brain, eye, and nerve health. So here's the fix. Eat the whole egg yolk and white. Don't eat it alone, have it with fiber or carbs like whole grain toast or salad. Avoid eating eggs first thing in the morning on an empty stomach. Quick question for you. How do you usually eat your eggs? Just whites? Fried in a pan? Maybe even raw in a protein shake? Go ahead, drop it in the comments below. I read every one. Because you'd be surprised how many men think they're doing the healthy thing when they're actually stacking up problems without even knowing it. Let's find out if your breakfast routine is helping you or quietly hurting you. Now let's talk about something even more dangerous and way more common than you'd think. Raw eggs. Some guys toss them into protein shakes. Others, especially older folks, grew up cracking one into a glass, maybe with a little vodka. Old school move, right? Well, here's the new school reality. Raw eggs can carry salmonella. And if you're over 60, your immune system isn't what it used to be. In younger people, salmonella might mean a nasty stomach bug, diarrhea, fever, maybe a few rough days. But in seniors, it can spiral fast into severe dehydration, hospitalization, or even sepsis. That's when the infection spreads through your blood and starts shutting down organs. It's a medical emergency. Let me tell you about Mark, 82 years old, former Navy guy. Fit, sharp, tough as nails. Every morning, he cracked 2 raw eggs into a glass, downed it, and went for his walk. Said it was how real men start the day. But one morning, he collapsed at home with a fever of 103. By the time the ambulance got him to the ICU, he was septic. Nearly lost him. We traced it back. The eggs were slightly expired, never cooked, and his immune system just couldn't keep up. After weeks of 4 antibiotics, his gut microbiome was wrecked. He had chronic diarrhea for months. So, if you're over 60, don't eat raw or undercooked eggs. Not in shakes. Not soft-boiled. Not runny. Cook them all the way through, yolk and white firm. At least 165 degrees Fahrenheit if you're being precise. Boil them, scramble them, steam them. Just don't eat them raw. And check the shells. No cracks, no dirt. Store them cold. And if they're close to expiring, toss them. Your health isn't worth the $3 savings. Trust me, I've seen how bad this can get. You don't want to roll those dice. Alright, let's do a quick recap. So far, we've covered 2 of the most common mistakes I see with eggs. Skipping the yolk, especially on an empty stomach. Eating them raw or undercooked like it's still 1980. Both of those can quietly sabotage your health, draining your energy, wrecking your nerves, or worse, landing you in the hospital with something totally preventable. So if you've been eating healthy egg whites for breakfast or cracking one into a shake to feel macho, now's the time to upgrade that habit. Because next, we're diving into something almost no one talks about: how eggs mess with your medications. If you're on blood thinners, antibiotics, or iron supplements, you'll definitely want to hear this. Now this one's critical, especially if you're on any medication. Eggs seem innocent enough, but mixed with certain pills, they can mess with your treatment big time. Let's break this down, starting with blood thinners. Ever heard of warfarin? It's a common one, prescribed to prevent blood clots. But here's the catch. Warfarin's effect depends on vitamin K levels in your blood. Guess what's rich in vitamin K? Egg yolks. So if you suddenly start eating more eggs, or stop eating them altogether, you can throw off that delicate balance. Too much vitamin K? Warfarin doesn't work, and you risk a clot. Too little? It works too well, and you risk a bleed. I've seen this firsthand. Harold, 85, sweet guy, former math teacher. He started eating 2 boiled eggs every day, trying to build strength, but he didn't tell his doctor. A month later, he shows up in the ER, internal bleeding. Turns out the eggs changed his vitamin K levels and completely threw off his warfarin dose. Now let's talk antibiotics. Eggs contain calcium, magnesium, and iron, which can bind to certain antibiotics and make them less effective. So if you're taking tetracycline or ciprofloxacin and washing it down with an egg breakfast, you might be canceling out the medicine's power without even realizing it. Same goes for iron supplements. The protein in egg whites can bind with iron in your gut, forming a complex that just passes right through, which means all that iron your doctor told you to take, you're not actually absorbing it. John, 76, had stubborn anemia, taking his iron pills every day, eating clean, but still exhausted. We dug in and realized she was having eggs with pills, every time. We spaced them out, 2 to 4 hours apart, and boom, his iron levels finally budged. If you're taking any medication, ask these 2 questions. First, does this drug interact with vitamin K, calcium, or iron? Second, should I separate it from protein-rich meals like eggs? In general, 1. Wait 2 hours between eggs and meds. 2. For critical meds like thyroid pills, statins, blood thinners, go 4 hours to be safe. 3. And always talk to your doctor or pharmacist if you're not sure. One small change in timing can make the difference between a drug that works. 4. And one that fails silently. Now, maybe you're thinking, Doc, I've been eating eggs like this since I was 25. I feel fine. What's the big deal? Hey, I get it. You've got decades of habits that seem to have worked. But here's the thing no one tells you. What worked at 40 doesn't always work at 60, or 70, or 80. Your body changes a lot. Your stomach acid is lower, that means weaker digestion. Your liver and kidneys, not as quick to filter and detox. Your immune system, slower, easier to overwhelm. Even your gut bacteria, the little army that used to protect you, starts shrinking and losing diversity. So what used to be harmless, raw eggs, early morning fried yolks, skipping a meal, can now turn into nutrient deficiencies, poor drug absorption, inflammation, or even emergency hospital visits. I've seen it in guys who were tough as nails their whole life until one small egg habit caught up to them. It's not about fear, it's about adjusting for the new reality of your body and giving it the support it needs now. You upgraded your phone 5 times in the last 10 years. Why wouldn't you upgrade your habits too? Let's talk about how to do that, starting with a dead simple checklist. 1. Don't eat egg whites on an empty stomach. Always eat the whole egg, yolk included. That yolk protects you from nutrient loss and gives your brain and nerves the fuel they need. Best time to eat, not right after waking up. Your stomach's still waking up too. 2. No raw eggs. Not in shakes, not soft-boiled, not old-school Rocky style. You're not 25 anymore. Your immune system can't bounce back the same way. Cook your eggs fully, yolk and white firm, to 165 degrees or more. 3. Time your medications right. Taking blood thinners, antibiotics, iron or thyroid meds? Space them at least 2 to 4 hours away from your egg meal, or that expensive pill might be doing nothing at all. 4. Skip the early morning eggs. Between 6 a.m. and 8 a.m. your cortisol spikes, and that can jack up your cholesterol. Instead, eat eggs in the early afternoon, between 2 p.m. and 4 p.m. That's your sweet spot for digestion and nutrient absorption. 5. No high heat frying. Frying eggs in hot oil destroys key nutrients, irritates your stomach lining, and creates toxic byproducts. Better boil, steam, or poach your eggs. Gentle heat means easy digestion and full nutrient retention. This isn't about never eating eggs again, it's about eating them smarter, especially as you age. So tomorrow, skip the skillet, boil 2 eggs, add some greens, and feel the difference in your energy, focus, and gut, because eggs can be medicine if you let them. If you found even one of these egg tips helpful, do me a favor. Hit the like button so YouTube shows it to more folks over 60 who need this info. Subscribe to the channel. We do practical, no BS health tips every week. Stuff that actually helps men feel better, think clearer, and stay strong. And if you've got a dad, brother, or friend over 60, send this video to them. You never know, you might just help them dodge a hospital visit.